Assalamu alaikum. It's Muhammad Musliuddin from Chittagong Medical College. Today we will discuss about the ventricular septal defect. So this is a heart, and here we can see the interventricular septum, and we know that the interventricular septum has two parts. The upper one is membranous part and the lower one is muscular part. The ventricular septal defect most commonly occurs in the junction between the membranous part and muscular part. So when there is a communication between the left ventricle and right ventricle, and we know that normally the pressure within the left ventricle is higher than the right ventricle. So the blood will rush from the left ventricle to right ventricle. In this case, the patient will not suffer from hypoxia. But gradually, when the blood comes from the left ventricle to right ventricle, so and right ventricle also receives blood from the right atrium, so more blood will accumulate within the right ventricle, so it will exert the volume overload, and the more amount of blood will go to pulmonary capillary or pulmonary circulations. So it will exert the increased pulmonary pressure. With the passage of time, the pulmonary circulation will undergo an irreversible vascular changes. This will cause the increased pulmonary pressure, that means pulmonary hypertension. Irreversible vascular changes is actually the pulmonary blood vessels will be rigid and its elasticity will lost, and it will cause the vasoconstriction. When there will be pulmonary hypertension, the right ventricle have to contract forcefully to push the blood forward direction. So there will be right ventricular hypertrophy. In this case, the pressure within the right ventricle will exceed the pressure within the left ventricle. So now the blood will go from the right ventricle to left ventricle. That means we can tell the shunt is reversed, and in this case the carbon dioxide blood will mix with the oxygenated blood. So the patient will suffer from cyanosis and oxygen deficiency. So we have seen that the left to right shunt is reversed into right to left shunt. And after these, the patient will suffer from cyanosis and oxygen deficiency symptoms. And the ventricular septal defect's clinical manifestations will appear rapidly than the atrial septal defect because the pressure within the ventricle is more higher than the atrium. So we find the clinical manifestations in pediatric age. Thank you being connected with me.